Greetings, everyone. Welcome to today's ISUB webinar, where we're going to focus on the 2025 World Drug Report. We really appreciate you choosing to spend this hour with us. I'm Goodman Sbego. I'm the scientific advisor here at ISUB, which is the International Society of Substance Use Professionals. So while we give our colleagues some time to join us, I'm going to share some introductory information about ISUB. ISUP is a membership organization for the global substance use workforce with over 45,000 members worldwide and still growing. We are an international network that unites, connects, and shares knowledge across the substance use prevention, treatment, and recovery support workforce. Our mission is to make the work of members as impactful, accessible, and as effective as possible. As you know, we do this by making it easier for you to discover and share evidence-based knowledge, best practice, training, and networking opportunities. If you haven't done so already, please visit our website, isup.net, where you're going to find information on how to sign up for our free membership. Our website also has a wealth of resources and publications for you to browse and engage with. You can also watch recordings of past webinars and listen to our new podcast, while also seeing future event listings. Thank you to the ISUP staff for providing technical support for this event. Before we get started, if we can just walk through a few items, letting you know how to participate in today's event. You will have the opportunity to submit text questions to our presenter by typing your question in the questions pane of the webinar interface on your screen. You may send in your questions at any time during the presentation. We'll collect these and do our best to address as many of them as possible during the Q&A session at the end of the presentation. Spanish interpretation is available today, so please see the chat box for instructions on how to access this. And a recording of this webinar will be made available for you to watch on demand after the event. Now, the World Drug Report is published annually by the United Nations Office on Drugs and Crime, the UNODC, and it serves as the leading global resource on drug trends, providing data and analysis on drug production, trafficking, and use. It guides international policy, supports evidence-based responses, and helps countries track progress on global drug control and public health goals. Now, the 2025 World Drug Report was released just last week on June 26th. And we're honored to be joined by Giovanna Campello to take us through some of the arising insights. Giovanna Campello is the Chief of Prevention, Treatment, and Rehabilitation section at UNODC. She's no stranger to any of us. She has more than 25 years of experience with the UNODC. Since 2016, she's been leading the Prevention, Treatment, and Rehabilitation section, promoting evidence-based, gender and human rights-sensitive practices on drug prevention, treatment, care, rehabilitation, and access to controlled medicines. Giovanna, very happy to have you back with us today, and it's my absolute pleasure to now hand on over to you.
Thank you so much, Goodman. Thank you for the kind introduction and for the opportunity, not only to you, of course, but also to all the colleagues of ISUP, to introduce to you the World Drug Report in what is now, I think, way beyond the coincidence. Twice it starts to become a pattern, what I would call a tradition. I need to share my screen and you will need to bear with me for a little while. We have rehearsed this, but you never know. And now I cannot see any of you anymore. So Goodman, if you would be so kind to tell me that everything is fine and you can see the slides.
It's perfect. Thanks, Giovanna.
Okay, wonderful. So here we go. Highlights for the UNODC World Drug Report, as Goodman mentioned, because most of my work is about drug prevention, drug treatment, care, rehabilitation, and access to controlled medicines. Like the one of many of you, I've chosen things that are more related to our work. And some that were of interest. And as I always say, I am presenting the results of the work of a huge team in the research and analysis branch. This is another branch compared to the one that I work in. And it is their job, that I'm presenting. They're big work in collecting data, collating it, analyzing it, writing up, creating the beautiful visuals. So of course, I would like to very much acknowledge this and hope that I will do justice to it. The World Drug Report is very, very rich. So here I first give you some latest trends in the drug markets, more from the trafficking and production point of view, because I think it's important for all of us to know, even if we don't work in law enforcement, to know what is going on in the drug markets. But also then I have a second part more on things to do with prevalence and harms and so on. So the first point that you can see on this slide is with regard to the cocaine market, and that is at record high. There is record high production, 3,700 tons only this past year. Record high seizures and use. What you see on the slides is the main routes of trafficking, and of course you can see here the very classic ones: Latin America to Europe to North America to Oceania. But look at not so small arrows also towards Africa and Asia. And there are really increasing signs that cocaine and harms related to cocaine use is rising, is being pushed by markets that enjoy very strong production into new markets like Africa and Asia. And that, of course, should ring an alarm bell in our head as providers of prevention and treatment to get ready to address this issue. And it's not that in the meantime, opium and heroin and the opiate market is going away. So here you can see the global opium poppy cultivation and production of opium. So as you can see, between 23 and 24, there is really not much difference. There has not been an increase after between 22 and 23, we had this precipitous drop, which is due to the ban on opium cultivation promulgated by the de facto government in Afghanistan. So what we are seeing in the markets, and you will find a better analysis of this inside the report itself, is that so far the market has been going on stockpiles, but there are signs that the stockpiles are dwindling. And of course, this is for us a very important, another alarm bell, because we all know what happened last time when there was a prolonged drop in the production of opium. Synthetic drugs came in. They were often more potent, more harmful. And there is the danger of this happening. And of course, we all know, we all have very clear, and the world has been preparing for a long time, about a possible expansion of what has been happening in North America with fentanyls. But what we are observing, and again, this is from the report of this here, is instead nitazines appearing. So look at the number of unique nitazines detected in selected countries, and you can see them coming up everywhere, all over the world, not only in North America, and also with many, also, for example, in Western Europe, but also in Oceania and in Latin America. And here you can see a very clear depiction of how potent nitazines can be compared to fentanyl and heroin. So again, something for our services, especially emergency services, that might find themselves confronted with potential overdoses, suspected overdoses by these very powerful substances, to be ready. Going back to stimulants, and focusing a bit on synthetic drugs. I believe we had something similar already last year, and I think that this picture is persisting, meaning if you look at all of the synthetic drugs seizures in 2023, you will see that almost half are amphetamine type stimulants. Very big a chunk of synthetic opioids and of miscellaneous and non-specified drugs, but very strong presence of amphetamine type stimulants. And seizures have been increasing, as you can see in this graph, and have been increasing also in non-traditional markets. When one thinks of amphetamines, for example, one thinks about Southeast Asia, but look at here in the near Middle East and Southwest Asia is the red line. In Europe and Africa, seizures are increasing of methamphetamine are increasing also here. And where there is an increase in seizure, there is an increase in use. And this is why I am interspersing some of the points that I'm making with some ideas and initiatives that we are supporting at the United Nations Office on Drugs and Crime. And of course, knowing that many of you already are connected to these initiatives, or maybe you want to know more, and that there are many other initiatives that we can share also in the question and answer session. So this is an initiative that we have launched last year, specifically on the treatment and care of stimulant use disorders. Why? Well, you have seen stimulant use disorder is on the rise, both around amphetamine type stimulants and cocaine. And unlike opioid use disorders, for which we have powerful pharmacological therapy, such as opioid agonist treatment with methadone and buprenorphine, that has been found to be effective in lowering drug use disorders, in preventing overdoses, preventing the spread of HIV and hepatitis C, lowering crime and recidivism. For stimulant use disorders, we do not have this, and evidence-based psychosocial interventions that do exist, such as cognitive behavioral therapy, such as family therapy, such as contingency management, are not used very much. So that's why we launched this initiative to move us all collectively forward in finding and disseminating scalable intervention for the treatment and care of stimulant use disorders. Back to our market trends. This is a very interesting slide that I will not talk about in detail, but I want to bring this to your attention. There are, if you look at seizures of pharmaceutical drugs that have a psychoactive effect and are used non-medically, you will find regional pictures. So for example, just to take some extreme, here you look at seizure of fentanyl. Of course, there are a few in Europe and Africa, but really concentrated in North America. But here you look at methadone, and it's very much concentrated around Eastern Europe. Pregabalin, particularly in some parts of Africa, Middle East, and Europe. Tramadol, very much around near Middle East and Western Central Africa, and so on. And this could be medicines diverted from the normal health system, the legal supply chain, or could be falsified and fraudulent medicines that are, put in the market precisely for illegal means. Whichever way, this is very much connected to the fact that in many, many countries, people do not have access to controlled medicines and therefore go to the illegal market to to find them, or maybe they have developed, of course, a drug use disorder. And this is also part of our work in promoting safe access to controlled medicines while preventing diversion and non-medical use. And maybe this is an angle that we as a community around ISAP have not explored that much, having been more concentrated around drug prevention, treatment, care, and rehabilitation. But I think it's an angle that also we can start to think about, because of course we know that the majority of people, especially more than 80%, especially low and middle income countries, do not have adequate access to controlled medicines. Now, new psychoactive substances. This is actually something where we have some good news, I think. I think that it's the third year in a row where we see a decrease in the number of new psychoactive substances reported to have been on the market. And we know that the international community has been hard at work since there was this increase in the early 2000s to really try and review the harms of those new psychoactive substances that were persisting in the market and putting them under control. And this is paying off. Also, if you look at this in the toxicological findings in drug-related mortality overdose, this is new psychoactive substances, way much lower than overdoses connected to opioids, pharmaceutical sedatives and tranquilizers, cocaine, and so on. So I think this is a story that, of course, we need to keep on monitoring proactively, but this is where we see the international drug control system at work and having an impact at global level. What else do we have here? Oh, yes, this is very interesting chapter that I can summarize only up to a point. It is an entire chapter of the World Drug Report devoted to an analysis of how much drug trafficking supports organized crime groups and the different kinds of organized crime groups that exist. And this is particularly, you can see this here. And this is an analysis that is maybe more relevant for actual law enforcement colleagues, but it's incredibly interesting. Basically, the report analyzes different organized crime groups according to whether they're oriented more towards governance, very strong structure, or trade and just getting as much trade in as possible, and whether they are decentralized in their structure or centralized. Depending on how an organized crime group fits in this model, it will be the most effective way to address this organized crime group will be different. So, for example, something that stayed in my mind, maybe because I'm part of, in an organization, I'm part of middle management in a very centralized structure. If you want to take on the organized group, it might not be a great idea to really take on the head, because that would result into infighting and an increase in violence in the community. It might be more effective to get to the middle management of the structure, and so on and so forth. As I said, this is more for law enforcement colleagues. But one thing that I found very interesting in this chapter is also this. Look at this right side. This is the main activity of the criminal networks, and the example is from the European Union as assessed by Europol. And you can see that drug trafficking is more than 50% than the main activity for the most criminal networks. and probably a little bit more if you take into account the drug part of polycriminality. So this means that drug trafficking is still a very, very important source of income for organized crime groups. And in here, you just have some very basic but important figure as to the billions. These are billions of euros that of the value of the retail drug markets in the European Union. And the retail drug markets is what really the people who use them, people with drug use disorder, pay, right? These are the people that we work with. And therefore, I think that this is particularly important also to advocate for our work, because evidence-based drug prevention and treatment, if it is evidence-based and therefore it is effective, of course it means that there will be more people that are healthy, less people that use drugs. But less people that use drugs does not only means more health for individuals and communities, also means less money for organized crime. And in a world where many donors are more interested in weakening organized crime networks rather than achieving good health outcomes, I think this can be very important figures and points that we can use in our advocacy to promote evidence-based drug prevention and treatment. Now, moving on to drug use and related harms, maybe something that we are more used to. We have the new estimates for the global number of people who use drugs and prevalence use disorder. I can see here that somehow some of the last minute changes that I had done are not there, but if you are interested in the slides and of course in the report, you will find all the data. We know that there has been an increase of 20% in the number of users in the last 10 years. Now it's at 319 million people that have used drugs at least once in the past year. And, you know, a lot of this is also in line with population growth, but not all of this, because also the prevalence has gone up a little bit. You see, has gone up of 15% over the last 10 years. You can see the prevalence following these dots. And of course, we also have, which is a very worrying, although to be expected, 13% increase in the number of people with drug use disorder that over the last 10 years. I will come back to this slide. Let me talk about people with drug use disorder. First of all, the last estimate is still 64 million. The increase I've already talked about, but this I've not talked about, that we will talk a little bit more about, is the percentage of people with drug use disorder that are actually in treatment, which is scandalously low, is 8.1%. And we know from the World Drug Report 2024 that in fact this percentage had been slightly, but it had been decreasing in the past 5 years. And within this, of course, you can also see the very difficult situation for women with drug use disorder that are much less in treatment than their male counterpart, and this is absolutely not proportional to the number of women who use drugs compared to the number of men who use drugs. Then, of course, we also know that a lot of harms are connected particularly to injecting. There were 40 million people who injected drugs in 2023. So these are the latest data reported by the 2025 report, of which 6.9 million were living with hepatitis C, 1.7 million were living with HIV, and 1.5 million were living with both. And this is very, very, very important once you look at deaths attributable to the use of drugs. And you can see this wonderful graph that tracks 10 years, and that tracks both direct, that's directly attributable to the use of drugs, and that's indirectly attributed to the use of drugs. Let's look at the indirect one first. These are deaths that are due to another condition that it is in itself due to the use of drugs. For example, HIV/AIDS, hepatitis C, hepatitis B, or self-harm. And if you follow the colors, you will see how the biggest by now cause of indirect death is hepatitis C. There it is. HIV actually has been slightly decreasing as an indirect cause of death among people who use drugs. So this is a success story. Now, hepatitis B and self-harm appear to be more or less stable. Look at direct causes of deaths. You have the dark green, which is opioid use disorder. No surprise there, that we have known for a long time. And we were also discussing it in the previous slide. But look at the orange. Orange is cocaine use disorder. This is not a small amount of people that have died due to cocaine use. And we have seen an increase in the deaths, in the number of people dying of overdose connected to cocaine use disorder. And this is, I'm just saying this also as to underline our previous point that we were making on the need to get ready to provide a lot of treatment to people with stimulant use disorder. This is another very important and very interesting chapter of the World Drug Report, which is a bit difficult to summarize, and I invite you to really read it nicely because it's very, very rich. Basically, the colleagues have tried to disentangle the impact that drug use has on who? On everybody, on individuals, families, societies, and so on. So first of all, as you can see, they have distinguished very many different kinds of impact: health, public safety and security, criminal justice, socioeconomic functioning, and social impacts. Then they have distinguished how the impact can vary depending, of course, on the substance that is being used, how it is being used. We have just seen the great harm connected to injecting drug use, for example, but also the intensity, frequency, and so on. But the impact is also modified by individual factors, what they call individual modifiers, such as age, sex, race and ethnicity, socioeconomic status. For example, we all know that it makes a huge difference if you start using drugs at very young age because of the impact on the development of the brain. This is just, and we have discussed before how women are much less able to access treatment than men. So just two very small examples, but there are also contextual modifiers. I would call them almost environmental factors, such as what is the policy environment? Is it punitive? Does it provide services? Are the services available? What is the culture? Is there a lot of stigma and discrimination? Or is there conflict that is impacting the fabric of society itself? So all of these are discussed in great detail, and then the chapter dives in specifically on health. Of all of these dimensions, they dive in health, and they analyze the impact of drug use on health according to all of these modifiers, and distinguishing between acute adverse effects, but also long-term effects and mortality. And this is how they have conceptualized it. And the wonderful thing is that if you think about all of these factors and all of the pathways and how this factor can interact with each other, it's almost an individual pathways for every person, every family, every society, and so on. Because of course, the chapter also does not look about impact on one individual only, but the barriers of impact that are here, and they go here, it's much more than just the individual. Drug use has ripple effects, not only on people who use drugs, but also families, society, governments, communities, and neighborhoods. And as you can see, it's a very complex chapter. It would be difficult to really go into the details of it. I invite you all to pick it up and have a good look at it. This is a small additional slide on the provision of services and how it varies by region. So yes, this is the situation. This is the situation that we were talking about, the 8.1% of people with drug use disorder that are in treatment, very low. But you can see that there is lack of data or a lot of variation and lack of services by region. So something that we should keep in mind. And also, if you start drilling down into, for example, the accessibility or the coverage of specific evidence-based interventions. Here you have opioid agonist maintenance therapy, you have naloxone, and you have needle and syringe programs. The situation becomes even less rosy than what I've described so far, not to mention, of course, the issue of quality that we have worked so much together about. And that is, of course, my plea to pick up our summary of what works in prevention and treatment. I know that you all are very, very much aware about it, but if there is one person that is not aware, we do know what to do. We do know what is effective drug prevention. We do know what is effective drug treatment, care, and rehabilitation, and we have summarized it for you in this and many other publications together with the World Health Organization. Among us in this community, there are a lot of people that have a long-standing experience in training about these standards, in developing specific tools to implement specific interventions that are contained in these standards. Let us connect and use them together. Finally, and a very important few data points on the criminal justice response that I think is of great interest to all of us, specifically those of us in this community that have been working hard about providing treatment as an alternative to incarceration or alternative to conviction and punishment in appropriate cases of a minor nature for people who use drugs and people with drug use disorder in contact with the criminal justice system. And know that this work is more relevant than ever. Here on the slide, you can see the estimated number of people worldwide in different stages of the criminal justice process for drug-related criminal offenses. And you can see here, so the criminal justice process here, you have the formal contact, which is, contact with the police that results in an arrest or in a caution or something like that. Then there is prosecution and conviction. And the blue is why these things happen for drug use or possession for personal use. Orange is drug trafficking and other related drug offenses. There are many, many people who are in contact with the criminal justice system or who are prosecuted or convicted for drug use and possession. only. And these are people that we know because drug use disorder are a health condition that responds to treatment, not imprisonment. These people will not manage to stop using because of imprisonment or prosecution. They need services. This is another way of looking at this. We're looking at countries and which countries criminalize specific drug-related activities. So, of course, you have other drug-related activities such as cultivation, diversion of precursors, production and manufacture, trafficking, but also purchase, cultivation, and possession for personal consumption and personal use. And here I think you can see that the response is fairly consistent globally. Most include a criminal justice response, or a few depends on the circumstances. But here, where we are talking about personal use, personal consumption, there is huge variation, and there is still many countries that have a criminal justice response to use or purchase, cultivation, and possession for personal consumption, and only few that use not an offense, or no, they use the flexibility on non-criminal responses. And here you can see the same data, but by region, and you can see how, for example, in Africa, there is a very strong criminal justice response, while in the Americas, in Europe, and in Asia, there is a bit more flexibility. And here you can see the distribution of custodial sentences length. So from 1 year, less than 1 year, 1 to 5 years, 5 to 10 years, more than 10 years, by offense type. And there is a lot of people, let's say the majority of people, also for possession and use, that receive custodial sentences. So they are imprisoned for more than 1 year, up to 5 to 10 and 10 years. And I think that we have worked together a lot on promoting treatment and alternative for people who use drugs and people with drug use disorder in contact with the criminal justice system. Here you can see our original publication on this issue, but of course, in this community, a lot of people have been working on alternatives to incarceration. And let me very much underline that one of the reasons that we are promoting this, for two reasons. First of all, because it is providing treatment and care in this context is the only thing that will address the drug use disorders, but also because it results in less crime, less recidivism, less prison overcrowding, and as you can see on this slide with a very, very old data from the United States, so that we have known for a long, long time, the cost of drug treatment is much less than probation, incarceration, and doing nothing, untreated addiction. So again, I think that in the World Drug Report here and here, we can find a wealth of data to help our advocacy for the importance and effectiveness of alternatives to conviction and punishment. And I believe that with this, yes, I am done. This is the QR code that brings you to all of our resources, but you can find all of our resources on the ISAP website as well. And do follow us on X and LinkedIn, because that's where we post things as we can. It becomes, they become available if we do something new and so on. And with this, I stop sharing and I give the floor back to Goodman to see if there are any questions, if we can have a bit of a discussion. Many thanks.
Thanks, Giovanna. I'm not letting you give the floor to me. I'll share it with you. Thank you so much for that, Giovanna, and just really for highlighting the broad impact of drug use and use disorders on various levels of individual and community functioning. It's interesting that you've noted the decrease in new psychoactive agents, but that somehow that doesn't really save us from the scourge of drug overdose deaths, and the rising number of folks who seem to be engaging in substance use, keeping in mind, of course, the potential reasons that that might be the case. And I think really concerning, especially, is the cocaine and cocaine-related harms that are seemingly driven by the market penetration in our region, in the region of Africa and Asia. And it's certainly especially concerning in view of the rising cocaine-related deaths. I'm being very quick in my reflections because we have some really interesting questions, but I just want to say a couple more things. That, the lack of access to controlled medicines is obviously a real concern. And it's something that, as you mentioned, really reflects the varied global control of pharmaceuticals. And it really presents a complex and uneven challenge that we really have to figure out how to deal with. And when we think about the fact that drug trafficking remains a key source of income, the other side of that coin is when we talk about screening, brief intervention, referral to treatment, and community level interventions. What we probably don't talk enough about is how deep the pockets of industry are. That every time we have an intervention that we put forward, industry is geared to, profits its shareholders, and so they have very extensive interventions centered now on social media and artificial intelligence. So that's a real challenge that we're going to have to be dealing with as we continue to try and tackle substance use disorders. One last thing I want to say is, of course, the concern around how varied it remains, the extent to which countries criminalize drug related activities, in the context of, in fact, imprisoning folks not really having any disruptive impact on drug markets. So that's really something to think about. So having said that, I'm going to head straight to the questions. Our good friend, Prof. Rataimane in South Africa wanted to know which country is winning in terms of reducing harms due to drug abuse. The second part of the question is, are rehabilitation services available that are available? Are they helping drug users? Is there a good example?
So, that's a difficult question. So, which country is winning? Not many, I can tell you. So, those green graphs that I showed you, those are based on self-reporting, right? This is the member states telling us what they do. You can imagine it's a bit of a rosy picture. But outside of the World Drug Report, I have looked at some data, especially from Europe. I would say Europe for now. Even in Europe, where, as you saw, there was higher coverage of services. If you look at the services that are particularly needed in the context of opioid use disorders, because they prevent also overdoses, HIV, and hepatitis C, and so on, only 4 countries, 4 out of all of the Europeans hit the target of coverage that WHO and UNAIDS had identified for the interventions to be effective. So I will not name winners, I will not name losers, but just as a sobering fact that the coverage is not high anywhere. It's better in some regions than others, but is still inadequate everywhere. And in reality, with regard to the second part of the questions, I think that what is more useful is to look at the different interventions and look at how we have strong evidence of effectiveness in terms of lowering drug use, lowering drug use disorders, improving quality of life, lowering crime, lowering recidivism, and prison overcrowding. And this is particularly around the opioid agonist maintenance treatment, but also there is some strong evidence from some psychosocial interventions, particularly screening and brief intervention that Goodman was mentioning already, but also contingency management, family therapy, and cognitive behavioral therapy. This would be our main ones.
So it sounds to me like, Giovanna, you're suggesting we should disaggregate how we measure wins so that we are able to recognize some of the small wins we're making while trying to make the broader impact.
Yeah, I mean, this is a part of the project syndrome, right? I remember when in our work we get a project, we manage to work with 3 treatment centers, and they tell me, let's evaluate impact at national level. And I say, how can that be possible? We are managing to cover, I don't know, for so many drug users, people that use drugs. This will not have an impact at national level, but I will be able to demonstrate impact among the people that we reach and how their life and the life of their families and communities benefit, so that we can finally go to scale. When we're going to scale, let's look at at the national data as well.
Thanks, Giovanna. So Jana Tapa, and I apologize if I pronounced your name wrong, has a question about the regulatory framework. So he's asking, how can countries balance drug control enforcement with public health and harm reduction approaches? And I guess the second part of that question is, what are the implications of rising synthetic drug use for countries with limited regulatory infrastructure in your perspective?
Yeah, so I think that in terms of balancing, the balance is very possible. And my response is always to bring people all around a table. It's completely useless that the drug control people on one side keep on shouting about the need to control more, and then the health people say, but what about harm reduction and so on? Let's sit around the table and think about making communities healthier and safer for everybody. And I think that that's where you create the space to identify the interventions that are non-punitive and that are supportive of the health of communities in general, children and youth, but also, of course, of people who use drugs and people with drug use disorder. And with regard to synthetic drugs, and especially in terms of responses, and also thinking about the issue of new psychoactive substances, things are scary. But at the same time, in reality, if you invest in, instead of fretting about what needs to be done to face these new phenomena, and you invest in evidence-based prevention, treatment, and care for me, of course, includes harm reduction and recovery support, you are taking care of 90% of the issues. And as we have seen, we are far from having that coverage that would allow us to be so, what do we do? Should we do a bit more of this, a bit more of that? Let's put our resources where our mouth is, strengthen evidence-based responses, and many issues with regard to synthetics will be taken care of. This is true of amphetamines type stimulants. And in the case of very powerful opioids, I think the one thing to keep in mind is that to think about the response to suspected overdose of very potent opioids will need higher levels of naloxone, and so this should be taken into account in stockpiling and providing first responders with naloxone. But you see, many countries don't even provide naloxone in the first place. So what are we talking about? Let's work on providing those evidence-based intervention in the first place.
Exactly. We know what to do, but are the resources available to actually do it? Pietro, your name is very long. I apologize. If I read the whole name, it'll take the whole question and answer session. He wants to know, he's really going to insist on the necessity of gender-based prevention, treatment, and care in African context. And this is something we talk about a lot, Giovanna, the dearth of data or inconsistency of data. So the question is, what can be done to update the data in these countries, in your perspective?
That is actually not a very easy answer at all, and one that my colleagues in the data collection in the research branch have been grappling for a long time. One thing that we do, especially in ISAP, given that we work a lot with services, right, is to make sure the services do collect basic data, are connected among themselves, and feed those data to a place where it can be used. I think that already that would help a lot to start understanding better what is going on. And absolutely, disaggregating the data is key so that we can really start seeing where the problem is. And we will need a bit more of investment on services for women who use drugs and women with drug use disorder. That goes without saying, but I repeat it nonetheless. But I think that starting to create networks of service providers that doesn't need to cost that much, but make it a habit of collecting the data and give back to the community a good analysis that helps them in their work as well would already go a long way, and it doesn't need to cost much.
So I've got two questions, Giovanna, which I feel are related, so I'll ask them together. The first one is from Abdulrahman Adeboale. He wants to know, especially having discussed now that we're seeing, less and less newer NPSs. He wants to know how much of a threat is the prevalence of synthetic drugs slash new psychoactive substances compared to conventional drugs globally in the year under review? And then related to that question, in my view, is Aliyu Baba, who wants to know what what steps is UNODC taking to address the emergence of non-conventional substances of abuse that are seemingly coming up in most parts of sub-Saharan Africa. He qualifies this by saying these substances are produced locally in most rural areas. A lot of people are
Yeah,
coming down with new range of dependence patterns. What are your
yeah.
thoughts, Giovanna?
Yeah, so there are a few things there, and that's a very good question. So in general, prevalence of can you still hear me?
We can hear you now. We lost you for a split second.
Yeah, I know everybody, you disappeared and everything. So I was saying synthetic drugs have been around for a long time. But you have seen both the and amphetamine type stimulants, for example, are a kind of synthetic drugs, and you saw how the seizures are increasing. Same for cocaine, which is very much a traditional drug. And in terms of NPS, which are a specific kind of synthetic drugs, I think that in reality the prevalence remains low. There are actually very few data about that prevalence worldwide of new psychoactive substances. But you saw the data about the mortality. It's not so high. It's very scary because we don't know what these substances are. But in reality, as I was saying before, a strong system that is well equipped to face normally traditional synthetic and non-synthetic substances would be in a good position to respond to new psychoactive substances. And this also goes for what the second part of the question with regard to the mixtures that of very, very different kinds of substances that seem to be appearing, especially in Western Central Africa, some of which are weird, strange concoctions, but then if you look very, very carefully, there is an etazine inside or something, a usual suspect, let's say, inside, but some that are genuinely very differently produced substances. I go back to my to what I was saying. In this kind of context, the big problem is not so much the substances, I believe, but it's the fact that the prevention and treatment system, through no fault of anybody, I don't want to make anybody feel guilty, but the responses are very, very fragile and weak, and so it's if we can use the fact that there are these unfortunate cases of drug use disorder and sometimes even deaths, to advocate for stronger prevention and treatment, I think we would go a long way to address this and many other possibilities that might come up. If we keep on chasing the substances, we will never end. So it's much better to chase, in inverted commas, actually to support the children and youth that are vulnerable to starting to use drugs, and the people who are currently already using and maybe are in danger of developing a drug use disorder, people that have a drug use disorder already, and support their health and recovery.
Thanks, Giovanna. So many questions, so little time. Vincent wants to know how effective have alternatives to incarceration been so far, having been launched in some areas in Europe and Africa?
So that's a good question in the sense that this is an area where there is less evaluation than in our normal areas of drug treatment and drug prevention. Also because it becomes a bit complex to evaluate. But where there have been followed and well implemented pilots of different kind of alternatives, as I was mentioning, they have been found to be effective in of course, lowering drug use disorders, but especially lowering recidivism and prison overcrowding. As I was mentioning, we are talking about relatively small pilots, and even us, with the collaboration of the United States in the past and with many of you, we have been able to implement only small pilots in Kenya and Nigeria that we are currently evaluating. So that handbook that I showed includes a lot of best practices and examples from different countries and different continents that people can be inspired to. We are hopefully soon presenting principles of alternatives to conviction and punishment that include concrete steps to develop effective alternatives to conviction and punishment. So hopefully we will still be able to expand the reach of this intervention and document its effectiveness better.
Thanks,
but look
Giovanna.
at the handbook. There are some good examples.
Perfect. One final question I'm going to ask you in the last minute that we have, and I think it was an unavoidable question. Raj wants to know what's the impact in the changed priorities of funders across the globe on the provision of care and certainly surveillance for drug use disorders, and what is a suggestion for a strategy to mitigate?
Well, the impact on the provision of services has been profound, particularly for those services that have been linked to HIV prevention. So around the opioid disorders, opioid use disorders, because of course the global community through the Global Fund and UNAIDS were supporting a lot of services directly, and these are closing. In our field, more on the maybe broader treatment systems, including also recovery, there has not been that enormous amount of funding, and therefore, of course, what is stopping is international cooperation, although this webinar is one shining example as long as all of us are there, we can and we should connect and keep on learning from each other, which is a fantastic opportunity. And I already put some of one idea in my presentation to try and advocate to policymakers, not only in terms of health outcomes. They don't seem to be that interested in health outcomes anymore, but they are interested in security outcomes. So they will be interested if you tell them that our evidence-based drug prevention and treatment mean less crime, mean that less money in the pockets of organized crime, means less youth recruited to drug trafficking networks, and less recidivism and less prison overcrowding. So I think there is space to highlight that our health response, which is effective and necessary, also has very strong effectiveness on the security side and should be taken into account because it's in the self-interest of the policymakers. So that's part of the shift that we are trying to do in our advocacy, and hopefully if there are maybe we should have another webinar, Goodman, just creating more work for you, but where we share experiences of mitigating, as Raj was mentioning rightly so, the impact of this decrease in funding and still protect evidence-based services for the population that we serve.
Colleagues, it's clear that the impact of drug use is shaped by a complex interplay of factors. It comes out with every report, and these include the type of substance, how it's used, individual characteristics like age and sex, and broader contextual elements like policy and service availability. We've discussed this, as well as stigma. So these factors include diverse pathways of harm beyond health to include security and socioeconomic dimensions.
Yeah.
This really highlights that there's no single way which drug use affects individuals or communities. So thank you so much for Giovanna again for joining us for this overview of this hot off the presses World Drug Report 2025 and for addressing some of these really excellent questions. Thank you, everyone. We really appreciate it from colleagues who've joined us. It's been wonderful to have you with us. So this, ladies and gentlemen, concludes the webinar today. Thank you so much for joining us. We hope you found this session helpful, relevant, informative. You will get a follow-up email in the next 24 to 48 hours with a link to the recording. We always appreciate your feedback and suggestions. So follow the link in the follow-up email and please fill out the survey. Tell us how to get better. On behalf of ISUB, thank you for joining us today. Have a wonderful rest of your day.
Thank you.